I'm at the National Association of EMS Educators Conference, and I'm at the Anatomage table virtual dissection. Did I pronounce that correctly? Anatomage? Anatomage. It sounds French. It sounds French. Anatomage?
Yep.
Right? Okay. Yeah, I should know that. And I'm with Michael, who's a rep for Anatomage. And so this is a virtual cadaver table. And I'm not sure what the best angle is. I'm going to try to... There's lots of reflecting lights here, so let me try this. Okay. Now, you're probably going to talk, but I may have to repeat what you say just because it may not pick up unless you're good at shouting. So what am I looking at now? I'm looking at, well, obviously a body.
So yeah, this is the virtual dissection table.
Okay, you have to speak louder.
This is the virtual dissection table, and this is our full body female.
Okay.
And so what you can see here, this is real true life tissue color. So the tissue coloring here was not modeled.
This is real true life tissue color in a dead person.
Yeah, so
is it the same color when they're alive?
This was done before the embalming process.
Before the embalming, okay. Okay. So high fidelity dead person.
So here you can actually come in and make custom cuts. Okay. And you can always scroll through the plane of that last cut. And you can make multiple cuts at one time.
Like a CT scan.
So yeah, this wasn't a CT or MRI. So they were taking digital photographs of the cadaver as they sanded it down.
Really?
And our software then recompiles all of those.
I don't think non-medical people would like to hear digital photos taken of the body as they were sanding it down. I think my wife would be vomiting at that description, but I like it. Okay, carry on.
So we have a couple of annotations turned on here. We have close to 1,200 annotations for this data set.
Close to 1,200 annotations, yeah.
Now our full body male is a little more interesting. Here we have over 1,000 segmented parts.
Now the full body male is more interesting only because we see more, not because he's male. We're just for that, just want to make that distinction.
So here we can come in.
I don't want your company to get in trouble for.
Yeah. So we can come in and turn on or off certain structures or even entire systems.
So you can come in and turn on or off certain structures. That's amazing.
And you can create these presets. So this would allow you to simulate a dissection, going from superficial layers deeper and deeper into the body. And just an example of what this can do. Here we've isolated the skeletal system.
Right.
And here you can pull everything else away.
Can you rotate that back again so that we're seeing the front? Okay, this is interesting. I like this because one of the things I tell my students, can I put my fingers on the screen?
Sure.
Is when you palpate for landmarking for 12-lead ECG, you notice how the first rib comes off and it takes a hairpin turn underneath the clavicle. So when you lay your two fingers down, the palms of the two fingers down, right next to the sternum, just below the clavicle, you're basically straddling the second rib, and you can feel that intercostal space right at the sternum, and then you just go down to the third and then the fourth, and this is where V1 goes right here. Some people use the sternal notch and the angle of Louis. Complete, utter waste of time. So that's nice. Okay, thank you.
Yeah. So here we have search functions as well for students. So you can go through if you don't want to play with the annotation system.
So it identifies the bones as you tap on them.
Yeah.
That's amazing.
And it'll identify anything really that's visible here. So now if it's open to students during lab or discussion times, they can actually come in and save still images of anything that's on the table, and so they can create their own reference materials.
So they can log in themselves. They can do their own login and save their own images.
Right. Yeah, they can.
It's unique to that student.
Yeah,
that's cool.
Anyone, it's all the same login. I guess it's really how you want to set it up.
It's kind of creepy that you're logging into a body. That's just a little
essentially weird. It runs Windows underneath, so it's essentially just a computer.
Yeah, of course. I'm just being facetious.
Yeah. So it's primarily sold as an educational tool, but it has been FDA cleared to assist with surgical planning and medical diagnosis.
It's been cleared for surgical planning and diagnosis. That's amazing.
So here, this is one scan from our digital library.
Now, when you say that, I have to clarify, because I heard you say this yesterday when you were doing a demo, that surgical planning, that means that physicians can upload their patient files onto this Anatomage and examine it.
As long as it's in the DICOM standard for CT or MRI scans, they can load it in through USB.
What's a DICOM standard? Is that would an MP4 video constitute, or is it a TIFF file?
It's just the standard for what comes out of a CT machine. It's digital imaging and communications and
so
medicine.
it's like a JPEG or
pretty much
PNG, just a different file
2D
type.
Images,
Okay. Yeah. Would you be able to view that on any PC? That file type? Okay, cool. Cool. So this is cool. So physicians can look at their patient in 3D and plan out their surgery on this table. So this table could be sitting in a room just off the OR, like a conference room or something, and they can plan it out. That's incredible.
Yeah.
So what they'd use now would just be an X-ray box or something, or a laptop or desktop computer, alternatively. So this is.
I'm not sure.
You're not sure, yeah. So I'm guessing like an X-ray box or a computer with X-ray images. So this is really images on steroids.
So here, this was a post-op scan for an aneurysm clip surgery.
And what are these gold parts I'm looking at? That's blood vessels.
So yeah, this is blood vessels. This is scatter from the fillings in the teeth.
Really scatter.
So there's
just digital artifacts basically.
So actually, not digital, but even if you go into the original slice data here.
Okay.
So you can actually see, even if they were just looking at the raw slice data, they'll still see this scatter. So there's not much that we can do about eliminating it.
Right.
So here, contrast media was used, so you can see the blood vessels very well, and you can actually control how much soft tissue you take away.
Okay. Yeah.
Or bring in.
Or bring in.
Go up to the level of muscle, or even up to skin here.
Right. And that's a really ugly looking skin, but okay.
Yeah. So you can come.
So
here.
you're just taking a scalpel in order to slice off the top of the skull, so we can look inside.
Yeah, and you can see here where the clips were left exactly.
Okay.
And if you turn up the vasculature just a little more, so you can actually see the circle of Willis here.
You can actually see the foramen magnum looks like down there where the skull attaches to the spinal column. That's incredible.
And so
it's like a drain.
You can go down and you can actually trace, cerebral, vertebral blood vessels down through the neck. And something like this would be very hard to do on a cadaver without permanently destroying it.
Right, absolutely. Incredible.
And so here we can also play with visualization settings. Let's say if we wanted to simulate an X-ray, we can simulate an X-ray as well.
Yeah, that's nice. You can clear you see the spinous process. That would be C1 up there. That's C1, C2, C3, C4. I'm losing my finger here, but C1, C2, C3, C4, C5, C6, C7. Nice.
Yep. And so here, this highlights the densest portions of the scan. You can actually see the clips very clearly here.
Right.
And so again,
so you keep saying clips. What do you mean by clips?
So these are aneurysm clips that they basically they attach to the blood vessel that is close to bursting.
Right.
And,
Okay.
Just a surgical device that they leave permanently inside the skull.
See, I didn't know that. They leave those permanently inside the skull, those clips.
Yeah.
So they basically, now, do they anastomose some other vessels so they restore blood flow to that area, or do they just clip them and there's enough collateral blood flow
the collateral blood flow probably. I don't have
You're not a surgeon, yeah. You don't have a medical background. You do great, though.
Yeah.
That's awesome.
Well, I have a biology background, but not a medical background.
Right. Well, the biology background's good. Cool.
So here we also have our high-resolution library. And this is the same data that comes in our full body male and female. The only difference is because it's regional, we can show it at a much higher resolution. The hardware is capable of doing that. So it gets down even to 0.1 millimeter here in the ear, so you can see finer structures.
So one of the advantages I see to this, and tell me if I'm on the right track here, is that if you're at a mid-size or big college or university and you've got a cadaver lab, students could really make the most of understanding the anatomy using Anatomage first, and then making the most of their time with the cadaver.
Right. Yeah. So that's one way that schools have started to use it as kind of a pre and post lab dissection review. Now there's one school actually took one of their cadavers and CT scanned it at an incredibly high radiation. Because it doesn't matter, because it's
a cadaver.
And then they take that and they load it into the table, and they literally get that cadaver rendered in 3D, so it really becomes like a pre-lab dissection.
How many gigabytes would a digitally dissected cadaver be?
It's typically might be 100 megabytes. It's not even.
That's it, 100 megabytes?
Yeah.
Wow.
Yeah.
That's amazing. Okay, so now you talked about students creating their own images. Do they throw a thumb drive into this thing and then take it out and put it on their own computer to review later?
Exactly. Okay. Yeah, we have USB ports right here on the outside.
That's cool.
They can also do it through a network if you want to plug the table into a network through Ethernet.
Yeah. Now I could see this would be really interesting if you could somehow flip this table to face the class if you were teaching anatomy.
So you can hook it up to projectors.
Yeah.
We have display ports here, so if you wanted to do that,
you can do that.
You can certainly hook it up to other sources.
And that would look on the screen just the way it looks on the table here.
Exactly.
Right. That's fantastic.
So here, this is actually our 4D heart.
4D heart. Okay.
So we call it 4D because there's a time component here.
Now I'll be honest. The image of that right now doesn't look very good to me.
Well, it is a CT scan, so you can't see extremely fine structures.
Looks like a heart that's been dipped in acid or something. It's full of pockmarks.
Yeah, you can only do so much with CT data, but here we can see it beat in real time.
I was going to ask, so it's actually beating in real time. That's cool.
And we can still cut into this data here.
Yeah.
And so you can go down, you can see the different compartments of the heart.
Right.
You can show students how you can trace blood flow here. You can see vessels.
So can you upload different models? Let's say if you had access to a file of someone who had a cardiomyopathy or a baby with a tetralogy of Fallot, or
we actually have tetralogy of Fallot.
You've got tetralogy in there. Wow.
But
cool. You have transposition of the great vessels and all that other good stuff.
Yeah. So as long as you have the
so you don't have to pay extra for those.
No.
That comes with the software. Nice.
It does come with the software here. So yeah, as long as you have access to that CT or MRI data, you can always load it into the table.
This is way better than still images that I show. That was neat. What were we just looking at a second ago?
This is just the lungs around the heart here.
Okay, now I have a question for you. We pick up a patient who has an ST segment elevation myocardial infarction. We take him to a percutaneous coronary intervention center for angioplasty. Do you have ultrasound images of hearts where you see an occluded vessel and then they?
So we have examples of occluded vessels and stents, things like that. However, we have angio examples as well, but we are still working on ultrasound data because the problem with it is that it's dependent on the technician's handling of the probe.
Right.
So the images that come back are not always correctly aligned serially.
Right.
So it's harder for our software to work with ultrasound.
Right.
But we're looking into ways around that.
That's interesting. Okay. You going to show me something else there?
And yeah, so here it's just different rendering visualizations that you can play with here on the table.
Oh, okay. Yeah, that looks like a valve, a heart valve. Am I right?
I'm not sure if you'd be able to see valves specifically. So
does that opening there look like a valve to me? this thing here looks like a valve.
Yeah, yeah, I'm not sure.
Okay.
It'd be pretty hard to make out the valve. I mean, you can show where it would be, but on a CT scan, it's really hard to make it out.
Right, gotcha. Okay. I think I'm going to wrap up this video because it's getting a little long, and I'm going to upload it to YouTube later.
Yeah.
So, thank you so much, Michael. That was a truly spectacular demonstration.
Absolutely.